Hi, I'm Dr. Celia Egan, and welcome to True Women's Health Facebook Live. Tonight, we're going to have a very important topic that we're going to talk about, and that's the topic of blood pressure, or in medical terms, hypertension. So, what is our blood pressure? Our blood pressure is a pressure that's generated by our heart to get blood basically to all the important parts, right? So if you think about our heart being in the center of our chest, there's a great deal of pressure that needs to be generated in order to pump blood to our brain and all the way down to our toes. So it's totally natural to have blood pressure. The problem becomes when that blood pressure tends to start creeping up and up and up, and it can lead to some chronic diseases, which we're going to review a little bit later. So, to talk a little bit more about this topic and about blood pressure and hypertension and what that means for our body, we invited a cardiologist to come on and speak with us. So, tonight I have the pleasure of welcoming Dr. Nisha Jhalani. Hi.
Hi, thank you so much for having
Of
me.
course. So I just want to, review your, welcome all the way from New York. You're a cardiologist at Columbia University, as well as is it assistant professor?
Yes.
Yes. And we went to residency together at New York Presbyterian Cornell on the other side of the city.
We did, and it was a long time ago, and it was probably the favorite, part of my life.
I
Um,
agree. It was a lot of hard work, but a lot of fun too. And,
um,
and
yes,
so,
go ahead.
Nisha, I know that you care a lot about blood pressure in women.
Yes.
Okay. And so we're going to talk a little bit more about this topic, but first we want to get to know you a little bit better. So why did you go into medicine?
So I was always one of those kids that, and this is going to sound very cliche, but I was always one of those kids that knew I was going to be a doctor when I grew up because there were no other doctors in my family, and I felt like that was just like it wasn't, oh, I want to help people. It was, I am so interested in what goes into this. And then actually, as I went into the training process and as I was in medical school, the reason why cardiology was like the only thing I was ever going to go into was because it's so physiologic. So
Mhm.
cardiology, unlike so many other professions which are so unpredictable,
Yeah.
um, I could never be an oncologist. I could never be a gastroenterologist. Like there were things that could be ruled out, but cardiology is very sort of regimented.
Yeah.
And I think that once you make a diagnosis, there are a lot of pathways that you can go down, and not only providers but patients are very aware of like all of the options that are available to them. And hypertension is just one of those.
Yeah. And particularly, you focus on women's heart health. So why did you get involved with women's heart health?
So that's a very loaded question. um, so there's a lot of reasons there. It's not a personal reason. It's more so that I feel like um, I was a doctor that I always thought I would go into preventative medicine. I never thought that I would be working at an academic medical center with the ability to be able to influence so many people with ideas that are not novel, like they're not new. It's just about awareness. And so, what I realized after years of training is that 80% of cardiac events are preventable by healthy lifestyle changes, by knowing your risk and being able to modify your risk. That starts with seeing a doctor. That starts with having blood work, having your blood pressure checked, having all those things. But
Yeah.
but if somebody's on top of all of that, so many cardiac events could have been prevented.
Yeah.
And
That's really a fascinating statistic, right? Of 80% of the cardiovascular events could have been prevented with some sort of treatment plan, whether it be lifestyle changes or even starting a few medications.
yeah, exactly. And I think a lot of patients. So I think my role in why did I become interested in women's heart health is because women tend to be the people who buy the groceries, right? Like you're going to pick the meal, and you're gonna pick up the medicines, and you're gonna like figure out how your family is gonna live. And I think
Mhm.
this is it's more than just medications and diagnoses. It's
Yeah.
it's about like embracing a lifestyle change. Um, like promoting exercise, finding time, and women have the hardest time.
Absolutely.
Finding
I think we
time.
find a lot at True Women's Health that, um, the women are the last people that they think about, right? We think
Mhm.
about our kids and we think about our job and we think about our partners, right? But then we're kind of at the bottom. And
Mhm.
so it's so important to be a reminder that we need to carve out a little bit of time to think about ourselves and what that means.
Exactly. And honestly, from a cardiac perspective, I mean, it doesn't require a lot, right? I mean, it doesn't sound like a lot, but it feels like a lot because I will
Mhm.
say, even for myself, it seems like a lot. But 30 minutes of anything aerobic,
Mhm.
5 days out of the week, right? So if you can walk with a purpose 5 days out of the week for 30 minutes, that counts. Like, take a
Yeah.
walk during lunch.
Yeah.
If you can't do that, like if you absolutely cannot do that during the week, 75 minutes of vigorous exercise both days, Saturday and Sunday, that
Yeah.
counts too.
Yeah.
And that is literally AHA recommended.
Yeah.
So yeah.
So interesting. So let's talk a little bit about what blood pressure is. And we have a slide to sort of pop up about the official
Yeah, sure.
definitions. You know, um, so I was talking a little bit before we got connected, about that having a blood pressure obviously is normal, right? We need a blood pressure to keep moving blood to our vital organs, and that it only becomes abnormal or dangerous when it starts to go above certain levels.
Correct.
When you look at these numbers, what kind of numbers do you look at in your office in terms of being dangerous or sort of warning signs of needing to start medications?
So before a couple years ago, the definition of blood pressure was very different than this, right? So hypertension before this was defined as what we call stage 2 hypertension. So 140 or like over 90 was defined as hypertension. Now we know that normal blood pressure is not 120 over 80, but less than 120, less than 80.
I think
Anything
a lot of women may be surprised by that because I
it,
think they've been hearing for so many years that, they're 130, right? That they're okay,
And most
right?
people are like, "Oh, that's fine. My doctor said that was fine." But it's
Right.
actually not fine because look at this chart. So,
Yeah.
if you're 130 over whatever, you're still in that stage 1 hypertension. And so what the new classification of blood pressure has done is basically half of Americans are now defined as hypertensive. It doesn't mean
Mhm.
that all of these people need to be on medications. There are so many things that you can do
Mhm.
um, before medications are required, and we should talk about some of those. But it clearly raises the fact that unless, and then think about all those people that aren't getting their blood pressure checked.
Mhm.
So
Yeah,
right,
absolutely.
it's called the silent killer for a reason. And so, but this very nuanced definition of blood pressure has really changed the prevalence of hypertension in the country.
Yeah, and we hear this a lot that, patients will come in and their blood pressure will be a little bit high, and we sort of chalk it up to this term called white coat hypertension, right? Which is the little bit of nerves that we get from coming in to see the doctor and getting weighed and talking about new things. I know I sit on the fence a lot of times in patients' rooms, kind of thinking about starting medication or not, and kind of wondering if it is white coat hypertension. Sort of, what is your experience with that, and what's sort of the thoughts in the cardiology world?
Yeah, so we are big proponents of having a home blood pressure cuff. We also, I personally am a big proponent of having. So for somebody who you find to be a new hypertensive patient who is not yet on medications, and
Mhm.
you want to know, like, is this a weight coat hypertension or is it something that is a chronic condition? Um, a 24-hour ambulatory blood pressure monitor is an amazing tool.
Mhm.
Again, it's one of those things that you should only use in patients who are not yet on blood pressure medications, but you suspect that they might have a diagnosis of hypertension.
Mhm.
Um, but I think it would be really useful because you want to know, like, again, like you said, blood pressure is a dynamic phenomenon. Like, you're
Mhm.
supposed to have high blood pressure when you exercise. You're supposed to have high blood pressure when you have an argument. You're supposed to have high blood pressure when you're like, you know, on a Zoom call talking about hypertension, like that, right? Like that, that's normal stuff. But there's a limit to it. And so, that's where I think having a 24-hour sort of, like
Review of what your blood pressures
review of
are.
what, yeah, exactly. A bigger picture of it is
Yeah.
really helpful. There are
Yeah.
some people who have white coat hypertension is absolutely a thing. And I think myself included, I always repeat, like for somebody who it's unexpected in, I will repeat the blood pressure 5 minutes after.
Yeah.
There's a very specific way in which you're supposed to do it. They're supposed to be sitting with their back up against a chair, feet flat on the ground, and their arm at heart level
Hmm.
for a couple minutes, and then you check it at that point, and it's usually lower. Um,
Yeah.
but if it's not, I mean, you could also have the opposite, right? Where people are much more worked up outside of the office. So
Yeah.
I think that's why a 24-hour thing would be
Can be
helpful.
really helpful. It's funny. I do a lot of coaching with patients who are going to do their home blood pressure checks,
Yeah.
and I'm like, if you just get off a phone call, an angry phone call with your kids or your boss, or you just watch the news, don't do it. That doesn't count, right? You kind of have to
Exactly.
feel calm, taking some deep breaths, not right after a workout, right? Or carrying in the groceries. And
Yeah.
it's supposed hypertension definition is for when you're feeling calm.
Yeah, exactly. So the way that you measure your resting blood pressure is supposed to be when you're absolutely calm.
Yeah.
The trick is, well, if you're stressed out most of the day, like a lot of New Yorkers are, or whatever, right? Like if you're stressed out most of the day, then is it really normal to check your blood pressure when you're absolutely rested? Like
Yeah.
probably not. So I
Oh,
think
that's a really interesting concept to think about if you're kind of
if you're
on clamped
stressed
down all
all,
day.
yeah,
Yeah.
if you're stressed all day long,
Yeah.
does it really help to check a resting blood pressure?
Yeah. I
So
really
that's why I think some of these the 24-hour blood pressure monitor, I think, is a really useful tool if you can get it reimbursed. But that's something that it's usually for people who are not already diagnosed with high blood pressure.
yeah. So interesting. All right. So obviously we both care about blood pressure. So, from your perspective, from a heart perspective, why do you think, not treating your blood pressure is a bad idea?
Okay, so let's talk about all the terrible things that blood pressure can cause. Um, so there's a number. I'm going to go head to toe.
We actually have a slide too, just for some visualization of
Oh, great.
sometimes it can be
So
super helpful.
hypertension can lead to increased atherosclerosis, which is basically inflammation within the arteries of the body. That affects all of the arteries in the body, and it does not discriminate. So
Right. So blockages in the major piping that supply
exactly. So
for
think of
the
arteries as
heart,
the piping,
brain.
right?
Yeah.
Think of arteries as the pipes that go to all of the different organs and all of the different vital things that have to happen. And so it varies between patients. But if your blood pressure is really high, you can have an increased risk of stroke. It can cause damage to the small vessels that lead to the eyes, and it can cause vision loss or retinopathy. It can lead to, by itself, a definition of a form of heart failure is hypertensive heart failure, which is basically that the heart muscle, if you think about it, the heart muscle is a pump, right? And so it's like pumping against, if the blood pressure is really high, this pump is pushing against a very high resistance. It's going to just do what every other pump does, right? Like if you're lifting a really heavy weight, your muscle is going to get really thick. And so the heart muscle can get very thick, and it can lead to a form of heart failure called hypertensive heart failure. Um,
I'm just going to pause you for a second, Nisha. I feel as though we really, since the expansion of something called echocardiogram, which is being able to look at the chambers of the heart a little bit more extensively, we're seeing more and more kind of hypertensive heart failure. And it's something that we kind of I don't feel like we've talked about enough, but it's really something that as people age can cause a lot of problems.
Absolutely. Yeah. So I
Yeah.
think it's one of the biggest causes of what we call, so heart failure is a clinical syndrome. And this is maybe a little bit outside of the scope of this talk, but heart failure is a clinical syndrome, which basically means that the heart can't handle all of the blood that's being pumped to it, right? And it's either a pump problem or a filling problem. So if the pump's not working,
Hmm.
then the heart is weak, like very weak, and then it just goes backwards into the lungs.
And a
But
lot of these patients have a lot of issues with leg swelling, walking, and breathing, right? Which really can affect later years of their life.
exactly. Yeah.
Yeah.
So right. So the other cause of heart failure is a diastolic problem, which is caused by hypertension. So if your muscle is really thick, then think about it. Your heart can't fill all that blood that's supposed to go into it, and then it causes all those symptoms that Dr. Egan's talking about. And so yeah, some of the symptoms are shortness of breath, especially if you're lying down in bed and you all of a sudden realize that you can't catch your breath, or you wake up in the middle of the night and you can't catch your breath, or you have to prop yourself up on more and more pillows. That's a really bad, like that's a sign that you're accumulating fluid in your lungs. And that's something that you should seek medical attention for. But also, like Dr. Egan was referring to, if your belly's getting a lot bigger, not because you ate a burger, but because it's getting progressively more distended for no reason, or if you have lower extremity edema, so like swelling in your legs or ankles, that's unexplained for some other reason, especially if it doesn't get better when you put your legs up at night, then that's absolutely a reason to go and see a doctor.
Yeah. Some of these sort of chronic things that come with having uncontrolled hypertension, at age 30, me being a busy mom at age 35, it's like hard to visualize this actually happening to me, right? But it's a real reality if I continue with uncontrolled higher blood pressures, that in my 60s and 70s, that, issues with my heart, issues with my brain, issues with my kidney and vision may be real.
Yeah, absolutely. So some of the things that are really important, and I hope that this is like the biggest takeaway that anybody can take, is that the anything that happens during pregnancy is a sign of something that can happen in the future, right?
I
So
think, Nisha, I think that's great. And I just want to give a shout out. A lot of times we have questionnaires that we have patients fill out, and a lot of the questions talk about pregnancy,
yeah,
right? And we're not trying to be too nosy, but we actually are trying to gather information. So
it
please
makes
continue
yeah,
about what happens during
it's an
pregnancy.
actual thing, right? So
Yeah, absolutely. And we really love hearing that information, right? Like a
this
good
is
doctor
something.
will want to hear that information about what happened during pregnancy.
So we think about cardiac risk factors as how old are you? Are you male or female? Do you have a family history? Are you diabetic? Do you have high cholesterol? But as a cardiologist that focuses on preventative cardiology and women's heart health, I ask, how many times have you been pregnant? Did you have any complications with these pregnancies? Do you have a history of premature labor? Because that, believe it or not, is a risk factor for heart disease, and things like that. Like your hormonal health actually
Mhm.
influences your risk in the future. So gestational diabetes gives you a 7 times increased risk of developing diabetes in the future, which is probably your number one risk factor for heart disease like coronary disease, atherosclerotic disease in the future, minus, being a smoker or something.
Mhm.
Um, Having gestational hypertension, having preeclampsia or eclampsia are all things that, again, are things that like women should be following up with a cardiologist literally, 6 months after they give birth. But so many times, because of obvious reasons, it just gets fallen to the wayside. Like
Yeah.
they recover, they have their baby, and like you're just so busy you can't actually follow up. But these are major risk factors for
Yeah.
future heart disease.
And I think, I would say it's really rare that we look through someone's past medical history. Myself as a primary care doctor, obviously I look at past medical history all the time,
Mhm.
that I see some of those things. But the more you sort of talk to patients about their pregnancies and really ask those questions, that stuff comes out. So, it's really important if you're a patient who's had those issues during pregnancy,
Absolutely.
just to make sure that your primary care doctor knows, and that it's in your chart, and that, it's a continued discussion so that we can optimize any heart health or vascular issues that are ongoing.
Yeah. I say all the time that women should start talking about their heart health at the age of 18 because,
Wow.
well, yeah, I think that it's something that think about primary. Well, you're a primary care doctor, so tell
Yeah.
me, like, if you're seeing an 18-year-old woman in your office, you're not going to think about their future cardiovascular risk. You're going to talk
Yeah.
about like, did you get your, Gardasil or whatever it is, right? Like
Yes.
we talk about whatever their flu vaccine, blah, blah, blah.
Yeah.
So there's so many other things that take precedence, but unless like my hope is that women become more empowered to be able to understand their own heart risk and then can start asking the questions to
Right.
the primary care provider. And I say
Yeah.
they're age 18 because I chose that as like you're an adult now, and that's when you're going to start setting your future, sort of that's when you're going to start setting your lifestyle
Yeah.
habits. You're
I
you're
know it's
either
funny. We talk to a lot of young ladies, and I kind of give them this mantra, like, if you don't get these habits laid down now, and then you get busy in
it's
your
so
careers,
hard to
maybe plus or
change.
minus you're having kids, oh man, it's giving me harder, right?
It's
So,
so hard to change. Are you
right.
kidding? There's a Peloton behind me. I literally have had to buy like
You practice what
I've
you
had to
preach,
buy
right?
every like gel thing that can go over the Peloton bike just so I can ride it. Like it's so hard to change habits. But
Yeah.
if you can do it early on when you're becoming an adult and when you're 18, that's really when you're going to decide, right? Like I'm either going to eat junk, I'm going to eat junk or I'm going to eat healthy. I'm
Yeah.
going to smoke or I'm not going to smoke. I'm
Yeah.
going to exercise or I'm not going to exercise. And like
Yeah.
this is when like habits form is in your 20s.
Yeah.
And when you hit your 30s, it's just too late. I'm not that it's too late, but like
It's not too
you
late. It's
want
just
to do
harder.
it
It's a
early.
little bit more
Yeah.
brain space that has to be
Yeah.
activated,
And
right, to sort of start getting things together.
and the
But
people who
it
are at
doesn't
the
mean it's
highest
impossible.
risk,
Yeah. Yeah.
exactly. The people who are at the highest risk, they need to be screened earlier.
Yeah,
Um,
absolutely. Actually,
yeah,
I'm gonna throw that picture up just one more time
sure.
because I think we gotta just touch base on 2 more things. So, you know, neither of us are kidney doctors, but we definitely know how important the kidneys are. And I know as heart doctors, you guys think about the kidneys all the time.
Yes.
Um, just as when there's really high blood pressure sort of coursing through the blood vessels that feed our brain and our heart that cause issues, our kidneys also have these teeny tiny, really delicate blood vessels, right, that feed and sort of filter out our blood and basically collect all the things that our body doesn't need and make urine. If there's a high blood pressure, it can damage those tiny blood vessels as well. And a lot of times we see when patients have untreated blood pressure, their kidneys can take a bit of a hit and not function as well, which again, at a younger age, it's kind of hard to visualize that, but it really can cause some problems sort of later in life, unfortunately.
Yeah. No, it's so hypertension, high blood pressure is one of the leading causes of like chronic kidney disease or even end stage renal disease. It's actually really sad to see. I think a patient ending up on dialysis because of uncontrolled high blood pressure for decades is one of the saddest things to see.
Yeah, because honestly, really shouldn't happen, right?
Right, right,
Yeah, yeah.
exactly.
Um,
So again, high blood pressure or any of these things is something that affects the arteries in your entire body. It's not just one particular space. So
yeah,
I'm a
and
cardiologist, but I'm not just focused on what it does to the heart vessels. It's more so what it does to the vessels in the entire body.
yeah. And another sort of interesting piece is that, our sexual organs, right, like our clitoris and a penis, are very vasculature. So a lot of the time, some patients will report sexual dysfunction, right, as kind of a sequelae of uncontrolled blood pressure. And God knows women have enough issues, right, without needing issues with blood supply in terms of keeping sexual function. So if any of those things on there, that may be like the number one reason not to have high blood pressure, right?
Yes, I agree. I think again, it's a systemic disorder, and it affects every artery in your body, just like atherosclerosis from high cholesterol, right? Like these are all systemic diseases that affect all of and they don't discriminate. And so how patients present can be variable, but yeah, that would be a very unfortunate.
Yeah.
Yeah.
So let's say that you are, a woman patient and you got it, right? You know that your blood pressure has been on an uptrend and you want to do something sort of make some changes. So what sort of, Nisha, how do you get started with making lifestyle recommendation changes?
So I think first thing is just make sure that there's nothing that you're doing to cause it, right? So a lot of medications can cause high blood pressure. Um, basically like oral contraceptives. If we're talking about women, oral contraceptives are one of the biggest offenders. So that can be a cause of hypertension. Anything, if you have chronic pain and you're taking chronic like anti-inflammatories like NSAIDs,
Like such as
that
ibuprofen or Aleve.
correct. Yep.
Yeah.
Though that can cause high blood pressure. If you already have high blood pressure and you're taking like cold medicines can acutely increase the blood pressure. And so, there are certain cold medicines that are supposedly less offensive for that. But that's usually just a temporary thing, right? Hopefully people are not taking cold medicine all day long, or all year long. Um, but in terms of like reversible causes, that would be one of them. Um, Also, so alcohol is a big issue. Um,
Nisha, I'm just going to pause for a second. I don't know if you've noticed this during the pandemic. A lot of women, all of us, right, maybe have relied on alcohol a little bit more than we used to before, just because it's been quite stressful, obviously, with the pandemic, and it's always sort of a big conversation, and that sometimes it's a good reminder that alcohol every day can cause some changes, even though we sometimes think that's not necessarily the case. We kind of have this magic number of 7 drinks per week that we talk to patients a lot about in terms of breast cancer risk. But we know, I think there was just that recent study that came out that even like 1 drink a day really can have some cardiovascular effects.
Yeah, so it's such a mixed bag, right? Because
Yeah.
there's like data that supports that 1 drink a day for women or 2 drinks a day for men is heart healthy. And then there's the other side that says that there's very clear direct effects on the heart muscle. So
Mhm.
I think in general, everything in moderation. But if somebody is a heavy drinker, particularly after the pandemic, and the blood pressure seems to be creeping up, that might be
One of
you
the things that we could
one
pull
of the
back
things
on.
that we could pull back on, right?
Yeah, absolutely.
Smoking as well. So
Yep.
smoking is one of hopefully nobody's smoking anymore, but if you are, then that is probably the number one thing you could do in terms of your entire mortality. Um, and then the other thing is exercise. So exercise, like I said, if you could, I've said it before, but not here. If you could put exercise into a pill, it would be
Mhm.
like the most expensive pill on the planet,
Mhm.
because the benefits just are like so. Oh, did I lose you?
Nope, you're still on.
I'm still on. Hold on one
Yeah,
second. There we go. Sorry, I got a phone call and
no
it.
problem.
So yeah, but like exercise can lower the blood pressure itself,
Mhm.
um, can increase the good cholesterol. What else? And it's basically the best thing you can do for your. So smoking is the worst thing you could do for your health, and exercise is the best thing you could do for your health.
Yeah. Do you, we talked to our patients a lot about like sort of stress management. And, we sort of made a joke that, if you're a person like all day, we love it if you took your blood pressure, if you were
Yeah.
calmer, but if all day you're really anxious and not feeling well,
Yeah.
that stress management or maybe learning how to deal with some of these ups and downs of the day may be really helpful. Do you guys have any sort of thoughts about that or programs in your
So
office?
yeah, so we live in New York. A certain level of chronic stress is just expected. Um, I think that the data supports chronic levels of high stress is absolutely related to worse cardiac outcomes. And
Mhm.
there are animal studies that prove this using like literally fancy imaging, like PET imaging,
Mhm.
that shows that chronic high stress leads to um, uh, increased inflammation in the bone marrow, in the like all of the tissues, and increased inflammation in the body, and therefore more promoted like atherosclerosis.
Yeah.
So this is something that is not disputed. Chronic high stress is absolutely one of the underestimated major risk factors
Yeah.
for heart disease.
And it's so interesting because, a lot of the times patients will, no one really doesn't know that they shouldn't smoke. Everyone pretty much understands that concept. But, why do we do it? We do it because people are usually feeling bad, right? Feeling stressed. And that's a way that they have a little bit of stress reliever. And so in some ways, investing some time into, some stress management can be really helpful on both
Absolutely.
accounts, right?
Absolutely.
So I do a lot. I'm an obesity medicine specialist, and I talk a lot about patients with, eating the wrong things. And for the most part, most of the time people do kind of know what to eat, but we, kind of get stuck in these situations mentally where we're feeling like we have to rely on food as a source of comfort. And so sometimes it can be helpful to kind of be curious to this question of stress management. In our practice, we talk a lot about metered breathing, and we talk a lot about having a meditation practice, which is sort of interesting. And I think that we'll only get more and more sort of data and information as that becomes more kind of widely accepted. But
so there is absolutely no harm. It's like meditation, yoga, like anyone who wants to try any of those things, there is absolutely zero harm, right? It's like exercise. Like if you want to exercise, if you want to do yoga, if you want to do meditation, if you want to just sit there and breathe for 20 minutes a day, like there is literally nothing but benefit in any of those things.
I'm doing any of those things. Yeah, absolutely right. And I think a lot of the times people find, pulling back on, less alcohol, less smoking, less sugar tends to be a little bit easier. I mean, that's what we talk a lot about with our patients. So it's very, very interesting.
Mm-hmm.
All right. Any other lifestyle stuff that you think about?
So other than that, I mean, so that we talked about the stress thing, we talked about the medications. No, I think that we've covered most of what I would want to tell people in terms of prevention.
In terms of dietary recommendations, do you guys do a lot of dietary counseling?
So salt is the big dietary, right?
Yep.
So it's so hard because most of our patients, at least here, most of our patients who have high blood pressure also have other comorbidities, right? So they also have diabetes, or they also have high cholesterol, or they also have coronary disease. And you don't, like, what is the magic, what is the magic diet, right?
Yeah.
But a lot of hypertension in many people, not all people, but in many people, is driven by salt intake. And so the first step should be salt restriction. And so we typically say less than 2 grams a day, but just try to limit anything. And it's not the salt that you're adding to your food; it's the sodium content in all of anything that's prepackaged or processed.
Yeah. We're big believers in flipping labels, right? Between the additive sugars and the additive salt content, sometimes it can be really shocking. So I'm a big, I don't care what it is. I would flip that label over, right? And just I always say it's like informed consent, right? Like understanding exactly what you're taking in so that you really know, right? And just seeing, I think one of the shocking ones is Diet Coke actually has a good deal of salt in it, much more than people think, because it's not particularly salty.
Yeah, no, I think all sugary beverages should be like banned from the shelves. But even Diet Coke, like I'm not a Diet Coke drinker. Ask John Egan, ask your husband. Sometime during residency, I decided that I was drinking regular Coke around the clock for like my first year of internship, and then like that switched to seltzer, and I've never looked back. So it's been at least
you had your aha moment, huh?
Exactly. I had my aha moment. It's been at least 15 years of just drinking seltzer, and I've never had a soda since.
Yeah. So, I mean, I think we're big believers of, we have a full dietary plan, where we kind of help patients with some guidelines in terms of eating whole foods, getting a ton of fiber, really, limiting some of the processed things such as added sugars and added salts, and really trying to stick with that kind of plan. And I think what you're alluding to is it's not really that sprinkle of salt on your vegetables. It's really some of the added salt that's in soups, sodas, sauces, that kind of stuff.
Anything that comes in a can, anything that's prepackaged, anything that's got preservatives, look at the sodium content. It's going to be through the roof. So if you can just stick to whole foods, like just eat basic foods, and cook your own food.
Yeah.
You don't have to be fancy, right?
Yeah.
Like just cook your own food. Then I think, it'll make the sodium part a lot easier.
Yeah, we talk to patients a lot about food, obviously. And, I found that the more you practice chopping up vegetables, the faster it gets. And that sounds like kind of a bougie thing, but at the same time, I wouldn't say that I was particularly skilled at it. but I can almost just promise you, the more you practice cutting up things, the faster it will get and the easier that will get.
Totally. Growing up in an Indian household, like, right, like I'm not a vegetarian, and my kids are not vegetarian, but my husband is, and we do not cook meat in the house. I literally chop up vegetables every night. And I'm telling you, I'm like, it's so much harder to be a vegetarian than it is to be somebody who eats, like, who could just like throw a steak on the grill, right? Like
Yeah.
it's like so much harder. But I feel like so much tastier. Don't regret. Also, I'll go out to dinner and I'll have like salmon or whatever. Like I'll do something that's like omega threes.
Right.
But I don't necessarily feel that you're missing out on anything if you're not, you know, if
Well,
you're
if you're not having the processed stuff, right? I mean, it
not.
can be, I find a lot of women, I mean, myself included, right, it's just easy, right? It's not, we always say making a good food choice is three things: education, logistics, and ability to make it at that moment, right? And the logistics piece comes up again and again and again. That's, how do I get it to my house? How do I cook it? How do I make it tasty? How do I afford it? Right. And, it's one of those things that it's just, the more you sort of practice
I
sort
think
of
that's the biggest
making
barrier to women. Yeah, that's the
yeah,
biggest barrier to women's heart health. It is. Is
yeah,
the access to healthy food choices.
yeah.
Because if you think about it, buying a salad, my salad this for today's lunch was $16 from Sweet Green. I love Sweet Green.
I'm not gonna lie, I don't miss those New York prices.
Yeah, so it was $16. I could have easily gone to Wendy's and gotten, like 7,000 more calories, but for $5.
Yeah.
So it's something that, and I hate to drop brands, but you know what I mean? Like, I'm just talking about what was the local,
I
like
think
in
that's true at any fast food
the
establishment.
local environment. Yeah,
Yeah.
exactly. And it just feels like there's such a hindrance in terms of, like, who's going to spend $16 on a salad? Like, even I
Yeah.
felt like that was ridiculous, you know?
Yeah. Yeah. It's
Um, yeah.
another topic that we talk about a lot is sleep. And a lot of the times, women can have undiagnosed obstructive sleep apnea, and that really can be a cause of untreated hypertension.
Yes, so it's actually not just women, but anybody who has high blood pressure.
Correct. Yes.
One of the things on the differential, and I should have mentioned it before, but obstructive sleep apnea can absolutely cause high blood pressure. The symptoms are usually you wake up if you're like a little bit, I mean, you would explain it better, but like if you wake up and you say that, like very broken sleep, if you've been snoring overnight, wake up with headaches, just like chronic fatigue. These are, sort of things that could suggest obstructive sleep apnea. It's diagnosed by a sleep study, which is done, at a sleep center by a pulmonologist. But that's absolutely one of the causes of high blood pressure.
Yeah. And, treatments then with what we call a CPAP machine or a BiPAP machine is where
Yeah,
they blow air into your airways to keep it open so that you're able to move air in and out all night. And then your body isn't sort of constantly trying to regulate its oxygen level, can actually help treat some of the high blood pressures that we see. Yeah. So, those are a lot of lifestyle things that we've talked about.
hmm
So, if those things don't work and our blood pressure is still high, then our next step would be medications.
correct.
Now, there's a bunch of different classes of blood pressure medications, and we're not going to review all of them today. But I think one of the things that we run into a lot of the times is, some of the first line treatments have changed, over the last 10 to 20 years.
Yeah.
And a lot of times when women, one of the old tried and true medications was this drug called a diuretic, which the main goal of a diuretic is basically to dehydrate you. And one of the side effects can be a lot of having to go to the bathroom all the time,
Yeah.
right? And so for, women maybe after having kids in their 40s and 50s who are dealing with maybe some stress incontinence or a little bit of tinkling here and there, that sounds like a nightmare, right? And so for them, they've heard from their mom or, an aunt that was just like, I had to go to the bathroom all the time. You're peeing constantly. And it just seems like, no way, no, thank you.
Yeah.
Right. But there are some other new drugs that aren't just the diuretics, although those are still good drugs. But there are some other first line treatments that we use now.
Yes. So I think, so that's again, a loaded thing. So the mechanism of hypertension varies greatly amongst people with hypertension. So if you think about 50% of the US population is diagnosed with high blood pressure, what is the mechanism in all of them? And what we know is that in particular ethnicities, African Americans, anyone with darker skin, is that it's more salt mediated. So it's more about salt retention. And so that was the reason why thiazide diuretics were recommended as first line treatment for that, because that was the most effective. You're basically treating the underlying cause of the hypertension for genetic reasons. There are other medications, and again, yes, of course, diuretics always have side effects, but it was very effective. And thiazides are not like it's not like you're taking Lasix. You're not going to pee all day long. Thiazide diuretics basically make you just lose enough salt that you're relieving the hypertension. For patients that don't tolerate that or have some other mechanism of high blood pressure, there are so many other medication classes. Like it's too many to enumerate.
Yeah.
But one of the ones that I would highlight are the angiotensin, like ACE inhibitors and angiotensin receptor blockers, and ARNIs, which are angiotensin receptor and neprilysin inhibitors. They have very long, complicated names, but it's a whole drug class, which basically shows protective effects for the kidneys in patients who also have diabetes or who also have heart failure.
Yeah. So a lot of the times all these things run together, particularly diabetes or elevated blood sugars and elevated blood pressure. So I honestly find myself giving patients that we call them the ACE inhibitors much more frequently, just because I have a lot of those comorbidities that come together. But it's really interesting.
Yeah. And then there's a new class of medications, the SGLT2 inhibitors, so sodium glucose transport. God, don't make me say the whole thing. But it's SGLT2 inhibitors. There's a few that have come out showing very positive benefits in terms of kidney, but also having not approved for high blood pressure, but for patients who have diabetes, who also have kidney disease, it has a beneficial effect.
It's really interesting. Those SG2 transport inhibitors are really big in the obesity medicine world because they've also been shown to help patients lose weight that have diabetes. And I think we're trying to tease this all out, right? Of what are these connections between?
Very complicated. Yeah. So the SGLT2 inhibitors have now entered a space of, it started as diabetes and now it's entered a space of heart failure and like kidney disease. And then the GLP-1. So for example, the medications you probably use in obesity medicine. So these once a week drugs that you can use for obesity are actually initially approved for diabetes. And so I think clearly, I think the takeaway should be that these are all interconnected. And if you have one of them, you're at risk for another one of them.
Yeah. And, for all of our patients listening, as everyone who's listened to me before, nothing makes me more excited than talking about the GLP-1s agonists, right? Which go by the brand names Wegovy or Saxenda, which we talk about a lot in terms of getting patients to lose weight. We've seen some good results, and it's always a good conversation to have with your primary care doctor. If you're trying to lose weight, have hypertension, have high blood sugars, that may be an option for you.
Do you really think that that primary care, now this is me just being naive and asking, do you think that primary care doctors are ready to prescribe an obesity dose of those drugs?
I do. I mean, the problem, Nisha, is that who else is going to do it? I will say we live in different spaces. I've worked in New York for 10 years, right? And moved to the Midwest. There just aren't enough providers, obesity medicine providers. Yeah. So it's just one of those things where it's gonna have to happen in order to get patients the right medications.
Yeah. Well, that's how I felt about the how I felt about SGLT2 inhibitors in the heart failure space, was like, who else is going to do it, right?
Yeah.
There's not an endocrinologist in the world, but I think that's amazing. I think obesity is like literally the next tackle.
Yeah, absolutely. And we know there's all these links between heart health and obesity, and we're just trying to figure the pathways out.
Yeah. So obesity is more the company it keeps, right?
Yeah,
So obesity goes along with diabetes and high cholesterol, and that's part of the metabolic syndrome and all of that. Obesity by itself has not been shown to be directly linked to heart disease, and so
mhm.
therefore, like you
Absolutely.
you
Yeah,
can be obese, but if you're not diabetic and your cholesterol is okay, then I can't actually say that anything's wrong. But like it's an interesting relationship, like how they're all
absolutely.
interconnected, but it's so individualized for each
Yeah.
patient.
And that's why, I mean, it's really important to have a good doctor who cares about these things and knows about these things to help
And
tease it
can
out for you.
and can tease it out. That's
Yeah.
exactly. Yeah,
All right. We are going to move on to our 5 take-home points. So I'm going to review, and you feel free to add some
sure.
interesting information if you'd like to, because we've already been talking for 45 minutes, believe it or not. So our first take-home point is make sure that you know the trends of your blood pressure. We've touched on this a little bit, right? So, your blood pressure in the office may be one number, but it's totally appropriate to get a home blood pressure cuff and learn how to use it and sort of keep track of those numbers on your own. I think they run in our area about $20 off of Amazon. So it's pretty easy to get one. And if you are finding really high numbers, we also could do a 24-hour blood pressure cuff if we really want to get a better understanding of where your numbers are out throughout the day. Okay, next. Number 2, know how blood pressure affects your longevity and other aspects of your life, right? Brain, eyes, heart, sexual health, kidneys. I mean, I don't know if there's an organ that it honestly doesn't touch. It's so important, and we really need you to know those numbers and sort of how it will affect your overall longevity. Number 3, we've sort of talked about it before again and again. Nutrition really matters, right? So learning how to, and I'll say it again, making good food choices, 3 things: education, what should I not be eating? Logistics, all right, I know what to eat, but how do I cook it? How do I get it to my house? How do I afford it? And ability, right? How do I turn down that pizza and beer on Friday night and have something healthy, right? I've had a long week and I'm stressed. And knowing kind of where your block is to making a good food choice can help you then figure out how to solve it. And, at True Women's Health, we have a lot of resources in all those areas. So it's always good to just be curious about why you're not making a good food choice. And
This
I
is
think,
this
go
is
ahead.
the hardest. Oh, sorry, Celia.
No, go ahead.
This is the hardest thing that people struggle with. And I had a patient who was readmitted with heart failure because of like fluid retention. He had coronary disease. But his pump function is normal. There was no reason that he was going to reaccumulate fluid so quickly. But he was readmitted 3 times. One of those and he's like a big Italian dude. And one of those during Thanksgiving, and we had this whole life talk about like, you need to stop you need to stop drinking. So fluid restriction, if your doctor puts you on a fluid restriction, that means that it's literally a liter or a liter and a half of fluid, any fluid, all day long. That's for heart failure patients. He was, I don't know what he was eating or drinking, but every time he went home, he went into heart failure. Every time he was in the hospital, he responded very well to the same medications that he was on at home. So it just tells you that sometimes diet is literally the thing that keeps you out of the hospital.
Yeah, and it's hard to make a good food choice. There's a lot of complicated factors that are involved, right, between society and our family structure and our cultural structures. So relying on, but it doesn't mean that if we're saying you have to eat healthy, that you have to throw all that away. Relying on whole foods is honestly the best place to get started and start practicing making whole foods meals, which I think can be really helpful. All right, number 4, focus on some other non-dietary lifestyle changes. Get moving, maybe think about cutting back on tobacco, which may be the first thing to start working on, and thinking about a stress management plan, right? If you're sort of, stressed out all day, we know your blood pressure is going to be high because that's the natural response to feeling stressed, but it's also not great to have it high just because of stress. So, working on a stress management plan would be really helpful, along with quitting smoking and get moving, whatever that may mean. All right. And I think you said 50 minutes 5 times or 75 minutes 2 times.
30 minutes 5 times. Yep.
Okay.
So 30 minutes of anything that gets your heart rate up. It could be as much as just walking with a purpose. 30 minutes a day for 5 days a week. Or if you can't do it because like your Monday to Friday is just like impossible, then 75 minutes of vigorous exercise. That's 75 minutes on Saturday and Sunday. That is what the cardiac societies would recommend, but it makes a huge benefit, not only on blood pressure, it helps your healthy cholesterol, and just is like the best thing you could do for your life.
Yeah. And, I always give this other side. Do something you love, right? If you hate treadmills, then don't buy a treadmill. Try to find something that you
Right.
love, that you at least enjoy some of the time. All right. And our last tip, know your phase of ovarian function. So we didn't speak as much about this today, but, we obviously care a lot about where women are in terms of their ovarian function. And we tend to see a lot of times as women transition through menopause that they develop some of the other metabolic syndrome things that disease processes that they hadn't had before menopause. So that can be uptrending blood pressures, uptrending blood sugars, and kind of an uptrending weight. So, understand where you're at ovarian function and talk to your doctor about some treatment options that may be associated with that. All right. And then 5 quick talking points to talk to your primary care doctor about if you're not in Michigan or by Columbia, New York isn't your place to be. 1, what is my blood pressure? We can't speak enough about understanding where your blood pressure is. And there's a lot of different ways to do that, even outside your doctor's office, right? 2, do I have any sequelae of poorly controlled hypertension? A lot of the times this is either looking at your heart or looking at even just a simple blood draw to look at your kidney function can be really helpful of kind of knowing where you're at if you haven't had controlled blood pressure for some years.
So I want to just echo in there. You echo in there, get it? So anybody who has had high blood pressure for a number of years should absolutely have a blood draw to check their kidney function. But also, I would recommend an echocardiogram. So it's basically an ultrasound of the heart, and you want to see like high blood pressure is such a silent thing. You could have had it for 20 years before you actually found out that you had it. So an echocardiogram actually looks at the thickness of the heart muscle. It's an ultrasound. It's absolutely no radiation, no contrast. There's no downside to it. But that's a reason to, I think a new diagnosis of high blood pressure is one of those reasons to get an echocardiogram.
I'm going to put you a little bit on the spot, Nisha. Would you recommend patients getting echoes who've had issues during pregnancy, like a preeclampsia?
I don't think it's unreasonable because a lot
Yeah.
of times these patients who have preeclampsia then go on to have hypertension afterwards. And again, unless you're checking it, you're not going to know that you have it, right? But it can still be causing your muscle to hypertrophy. It can still be causing LVH, left ventricular hypertrophy, basically meaning that your heart muscle is getting thick because it's pumping against a higher pressure.
Yeah.
And so I don't think it's unreasonable. It's not necessarily indicated for everybody, but it's one of those like decisions.
If you can do it, it maybe gets covered. It's not an unreasonable thing to look at. Yeah. An echocardiogram is really just an ultrasound. So there's really minimal risk other than cost associated with it. All right, great. All right. Number 3, to talk to your primary care doctor about, am I eating too much salt? Am I drinking too much alcohol? Right? These are some of the things that really sneak into our lives so quickly and quietly that we sometimes don't even pay attention to. And so it's at least worth the conversation and even food tracking, even for a week or two, just to kind of get a sense of where you're falling in terms of your salt content. And even just like kind of reflecting on if you're maybe having more than 7 drinks a week or definitely more than 2 drinks a day. All right. Number 4, am I a candidate for medical management? Right. So if we're thinking about those blood pressure numbers creeping above 130 and the bottom number above 80 or 85, then you definitely may be a candidate for medical management, which is adding some medications on top of your lifestyle changes. And I think it's definitely worth a conversation with your primary care doctor.
Absolutely. So I'm going to chime in there. Our current recommendations say that once a diagnosis is made, or once there is a high blood pressure reading, 3 to 6 months is reasonable to try to reverse it without medications. So 3 to 6 months. And that includes looking at medications that could have like potentially cause
Pulling out
hypertension,
medications. Yeah.
alcohol, smoking, stress, things like that. But anything that you can adjust in those 3 to 6 months. After 6 months, then it's reasonable to start a medication.
Yeah. I think it's really interesting. And I love the time frame of 3 to 6 months, because I do feel sometimes we sort of keep kicking the can down the road, so to speak. And it's, I tell patients, if we need to take it off, we will. I don't think it's a forever medication, right? If we're working on
A
eating
lot of people ask,
healthier,
is it a forever medication? Yeah.
yeah, fitting in more exercise, right? We get it that these things can be hard things to add in, and they can be expensive, and sort of figuring those pieces out. In the meantime, it's okay to go on a medication short term, right, for maybe a couple of months or even maybe a couple of years until we're feeling good and we get those sort of lifestyle stuff under control. All right. And our last tip, what is the role of stress management? You can tell in our practice, we talk a lot about stress management, right? And thinking about if your primary care office or your local area has any, meditation centers, mindfulness centers, Tai Chi, yoga studios, anything you can do to sort of bring that overall stress level down. Sometimes it can be even helpful to see a therapist for a session or two to really create a safe space and talk about some issues. And that really can change, your overall blood pressure and probably change your overall longevity, right? For all variety of different reasons.
Absolutely.
All right.
I think it's one of the hardest things. Point 5 is probably the hardest thing for women to do, right? Because we never make time to like do this for ourselves, but you're supposedly supposed to have like, self-care 3 times a day, and it's impossible.
Wow, that seems like a lot.
It seems like a lot, right? So
Yeah.
let's just start with 1 time a day where we have self-care, and then work up to 3 times a day.
Yeah.
But it's a lot. It's a lot.
Yeah.
As working moms, I can absolutely empathize that stress management is not an easy thing to tackle. And I don't have time for yoga. I get it.
Yeah.
But there's absolute benefit in all of it. Anything you can do for yourself.
Some of what we do, we teach our patients to do a little bit of, we call it metered breathing or some deep breathing techniques kind of in the moment, right? Like we get that bad email, that phone call from school, right? Your phone call from the daycare about something crazy. And even just taking 3 or 4 seconds, even 30 seconds of doing some deep breathing can really sort of bring everything down and change some of those dynamics.
Yeah.
And as always, at True Women's Health, we talk a lot about a lot of these recommendations aren't so much like a giant finger wag that what you should do, as more of like a gentle whisper, right? Of let us help guide you in the right direction of making good choices. So, well, Nisha, thank you so much of taking your time out from your kids and your busy schedule.
My pleasure. Went to bed earlier than they've ever gone to bed.
Oh, wow.
I'm sorry that it got so dark in the bed. Like the sun set while we were talking, I think, and like it got really dark, and I couldn't get up and turn on the lights. But
no worries. Well, thank you so much. I know you work with you work with a preventative program at Columbia University. Do you want to tell us just a little bit about that information?
Yeah. So we have like NYP as a whole, New York Presbyterian, has this huge web. Anybody who is in the area, there are preventative clinics at Cornell, at Columbia, at Hudson Valley, at Lawrence. We have cardiologists all over the place who are more than happy to take new patients. Anybody who needs a cardiologist, who is interested in just talking about their heart health. And like I said, there's never a time that's too early. So I say as early as 18 is the right time to talk about heart health.
I think that's great.
Everybody doesn't need to see a cardiologist at 18, but I think that anybody who identifies a risk factor, just, early prevention.
I think it's at least worth the conversation. If cardiovascular disease is the #1 killer amongst women, then it's at least worth a conversation.
Men and women, right? Exactly.
Yeah, absolutely.
Yeah.
And, and if you want to hear more, if you're listening either on YouTube or on Facebook Live tonight, and you want to hear more about our topics at True Women's Health, you care about menopause, you care about heart disease, weight, diabetes, blood pressure, and you're in the state of Michigan, you definitely can check us out at truewomenshealth.com. Thanks again, Dr. Jhalani.
Oh, my pleasure. Thank you so much for having me.
All right. Take care,
Have
everyone.
a
Good
good night,
night.
everyone.